Charlie, we know that exudate is a natural part of wound healing, but what is exudate and how does that complicate wound healing?
So we touched on exudate a little bit earlier in the inflammatory phase and of wound healing, and we need that moisture, that exudate, to help clean out that wound bed, get rid of any of that debris. And as wound healing progresses, you should see that the exudate starts to reduce. However, in hard to heal wounds, chronic wounds that are often stuck in that inflammatory phase, you will find that wound continues to produce high levels of, or moderate to high levels of exudate. So exudate is a thin, watery, consistent fluid that is really important, as I've just said, in that wound healing process. It's really important that we explain exactly what it is that we're seeing with that exudate, because it's not always watery, clear fluid that's quite thin in its consistency. It can be very thick, it can be pus-like, it can have an odour to it, it can be green in colour. So it's really important that we describe exudate exactly as we see it. If we don't manage exudate appropriately, if we don't manage that gap appropriately, we'll get pools of exudate in our wound, and bacteria like to sit in those pools of exudate, which increases that risk of infection for the patient. If we don't manage the exudate appropriately, particularly if we've got moderately or highly exuding wounds, then that exudate can come out of that wound bed onto the wound edge and that peri-wound skin and cause maceration, which increases again the risk of infection for that patient. There is tissue breakdown, there is increased pain. So it's really important that we manage that exudate appropriately to try and reduce the risks that are associated with it, particularly for the patient.
So managing exudate is really important for our patients because it helps to reduce pain and helps to reduce the length of time that people will have to live with a wound. So it's really important to have a dressing that's going to be able to promote moist wound healing. Moist wound healing is really important when it comes to treating hard to heal wounds, but also as well it's going to manage the gap, so ideally a conforming dressing that's going to maintain that moist wound healing environment and is going to manage exudate effectively.
Absolutely. And the dressing also needs to contain that exudate and any of the bacteria that has been taken out of that wound. That's really important too, and not just for chronic or hard to heal wounds, but all wounds. We need to make sure we provide that moist wound healing environment.
And that's really important for our patients. If we can manage exudate effectively, it's going to cause less embarrassment when it comes to leakage of exudate onto clothes, bedding, but also as well manage the odour and help prevent malodour and the embarrassment of having an odorous wound.
Absolutely.